Hey, yo, lesson here, babe. You come at the king, you best not miss.
Now let's go over and say hello to my guest, standing by, Dr. Charles Gant, G-A-N-T, M.D., Ph.D., and he is a person who's very concerned about the medications that many children are receiving, and he is an author and teacher, and most of all, a practitioner who provides innovative and personal care for his patients. And Charles has practiced functional and integrative medicine and mindfulness-based cognitive psychotherapy for almost 40 years, and he's with us now. Nice to have you with us today.
Thank you very much for having me on the show today.
I began to research the association, whether it was causal, casual, or non-existent, between the psychiatric medications people were taking and those same individuals committing acts of violence that, according to their parents, they had never previously seen in those same children. And I just want to, before you answer me, I'd just like to go to this one statement here that I'm going to read to you. It says, before the late 1980s, mass shootings and acts of senseless violence were relatively unheard of. Prozac, the most well-known SSRI, selective serotonin reuptake inhibitor, antidepressant, was not yet on the market. When Prozac did arrive, it was marketed as a panacea for depression, which resulted in huge profits for its manufacturer, Eli Lilly. Of course, other drug companies had to create their own cash cow and followed suit with marketing their own SSRI antidepressants. Subsequently, mass shootings and other violent incidents started to be reported. More often than not, the common denominator was that the shooters were on an antidepressant or withdrawing from one. This is not about an isolated incident or two, but numerous shootings. The question is, during the past 20 years, is the use of antidepressants here a coincidence or causation? There have been too many mass shootings for it just to be a coincidence. Eric Harris and Dylan Klebold killed 12 students and a teacher at Columbine High School. Eric was on Luvox, an antidepressant. The Virginia Tech shooter killed 32 people, and he was on an antidepressant. And while withdrawing from Prozac, Kip Kingle murdered his mother and stepmother. Then he shot 22 classmates and killed 2. Jason Hoffman wounded 5 at his high school while he was on Effexor, also an antidepressant. James Holmes opened fire in a Colorado movie theater this past summer and killed 12 people and wounded 58. He was under the care of a psychiatrist, but no information has been released on what drugs he may have been on. Psychiatrists generally will tell you that these people were mentally ill and they weren't treated in time or didn't get enough help to prevent the tragedy. However, Dr. Peter Breggin, who is a psychiatrist, stated that depression rarely leads to violence, and it's only since the SSRIs came on the market that such mass shootings have taken place. So could you give us your insights on what you have found is the association between taking the medications or withdrawing from them and what it does to our perception and that could lead a person to violence against others or themselves?
Well, what I do is, through functional medicine and genomics, is I look for the underlying root causes, toxicity causes, immunological causes like Lyme, nutritional deficiencies, inability to make the neurotransmitters, gut dysfunction, and so forth, and the genetic. We look at neurotransmitter genes that allow you to make the neurotransmitters, or genes that allow, receptor genes that allow them to work. So we have this broken down pretty well now, especially in the genomic age. We know why depression, all the common mental disorders, we can see their biochemical roots, we can test for them and reverse them. So the use of psychotropic medication, except for acute psychotic episodes, generally speaking, is obsolete. It's obsolete because we simply have a much better technology to address these kinds of problems. So putting a toxic substance in the brain is relatively obsolete and can be very harmful. It can disinhibit the executive function,
impacting a person's perceptions. We'll get to that after he speaks.
Can you hear me okay now?
Sure can. Please continue.
Okay. So I have the regular phone. So yes, basically we have this executive function that looks at the choices and their consequences. It's the prefrontal cortex and associated structures, and we know from PET scan studies, neuroimagery, that all psychotropic toxins have a major impact on this executive function, and people lose an ability to see the consequences of what they're doing or what they're planning to do. So, unquestionably, there is a disinhibition and the adverse effect on this most important part of our neurological hardware, our frontal lobes, that simply people can't see what an impulsive behavior is going to do because they can't see the consequences of it. So with those who are vulnerable biochemically from heavy metals or nutritionally, like essential fatty acid deficiencies, or they could have Lyme disease or neurological Lyme, some infection, they got gut dysfunction, any number of risk factors that would complicate this whole neurological or neuropsychiatric problems, which are at the cause of psychiatric disorders. When those factors are in place, plus who knows, a person could have post-traumatic stress disorder or been abused. There could be any number of things. When you throw chemical at them, that's the psychiatric approach. You throw chemical at somebody, the consequences are totally unpredictable. And the black box warnings on antidepressants, especially in young people, are there to as proof of that. So several years ago, I interviewed a Mormon family in Utah. The son had been having a little difficulty in a relationship, as a lot of teenagers do, and otherwise he was an exemplary student. He was a top athlete in football and basketball. He was a high-grade student. He was very well-mannered. And so his father, to help him, put him on some antidepressant. The next thing, after taking the antidepressant, the kid woke up, he was in jail. And he said, "Where am I at? Why am I here?" "Well, you've been arrested because you took a gun to class and threatened to kill the students in class. And you didn't kill anyone, but you're here." And he had to go through a long trial, and his family had a lot of difficulty trying to show that he was completely normal until he had the medication, because so many other psychiatrists in the area were opposed to trying to line the idea that maybe it was the meds he was on. And yet that's the only thing that he changed, and he had a horrible time getting off the meds, as many people do. It's not an easy process. It's not just walk away from it. From SSRI can be very, very unpleasant. We provide people 5-hydroxytryptophan, the precursor for serotonin, that greatly modifies the withdrawal symptoms. But you mentioned Eli Lilly. They knew. Yes. They had trials as far back as 1984, before the drug was approved in 1988 that indicated that this kind of agitation, anxiety, and violent behavior was possible. And I forget, I think it was in the postal trial where a guy goes, they call it going postal. In that trial, I forget when that was, but it was, some years later, the judge could not get they couldn't get their hands on the earlier trials. Eli Lilly hid it in the courtroom because they did not want to suffer from the embarrassment and from the legal consequences of a very, very violent activity that happened as a result of taking Prozac. And it's not just Prozac, it's all the SSRIs, actually.
Since January 1, in less than 2 months, in the United States, we've had 18 school shootings. 18. And we're not looking at all of them. If you go back to January 3rd, St. John's, Michigan, or January 4th, Seattle, Washington, or January 10th, Sierra Vista, Arizona, or San Bernardino, California, or Denison, Texas, or Marshall, Texas, or Winston-Salem, North Carolina, Italy, Texas, Gentilia, Louisiana. You have all these shootings, and thus far, we see most of these kids have been on some form of antipsychotic or antidepressant medication. Not once will the media discuss this. Why?
Well, that's their sponsors. Let's take a station break and go to the advertisement. And some pharmaceutical company is going to be affected adversely by this negative. They even hid they sealed the records at that Virginia Tech shooting. We still don't know, as far as I know, if that kid was on antidepressants, but he had been seen by psychiatrists and had been treated, but we don't know what his blood levels were and so forth. So I don't doubt that there has got to be a role of some of these drugs, or, I mean, let's face it, lead levels can get so high, can have such a neurotoxic effect that they can cause this kind of behavior too. So we know that it's a neurotoxic effect of medication at the very least, or some combination of neurotoxic effects, nutritional deficiency, and so forth that is causing this. The executive function simply gets shut down. It isn't there.
I'm going to quote a paragraph from Jerome Corsi's Psychiatric Meds linked to 90% of school shootings, and this was an excerpt from Psychiatric Drugs Likely Cause of Lanza's Extreme Violence, and it says some 90% of school shootings over more than a decade have been linked to a widely prescribed type of antidepressant called selective serotonin reuptake inhibitors, or SSRIs, according to British psychiatrist Dr. David Healy. And then it goes on to talk about all these are happening, and yet no one is investigating. The government, local, state, federal, and also we have a lot of reporters, investigative journalists with outstanding backgrounds. They're very intelligent. They're very well read. They have capacity to resource anything with the companies they work with. And yet not one single orthodox mainstream person has gone after this connection. And you just said it was possibly because of the advertisers. What does that tell you about the integrity of a journalist?
Well, that's always a question. But big media, I mean, they want to keep their job. They're told by their bosses what they've got to do investigations on and what they better not touch. So it's, they just want to keep their jobs.
What happens when you discuss this with your colleagues? That's my guest.
Studies that combine all the other studies and look for the overall trends, they don't see that SSRIs really have much effect. There is very little outcome proof that they work at all, except for the most severe types of depression. So when they combine, all the studies into one big study and look at the overall trends, they really don't work. And so it's been a massive publicity campaign that and doctors know this too. They see that it's not working, and they say they've been fed a whole bill of goods. It just doesn't work, and patients see that they don't work. But the placebo, when you compare it to placebo, the placebo effect can be up to 20%, and then the enhanced placebo effect, if the medications cause side effects, dry mouth, and dizziness, and whatever, there's an enhanced placebo effect up to 40% that the person believes it must be working because it's causing side effects. And when you look at these studies, they simply don't offer much advantage over placebo. So not only are they causing terrible withdrawal symptoms, not only are they releasing the tendency of violence, they also are a very, very poor treatment for depression.
I read a major study that the placebo had equal effect as Prozac, so the placebo is just a sugar pill, and therefore if you're going to take something that didn't work, take a sugar pill, because at least you're not going to end up with brain dysfunction as you would otherwise. I'm just very concerned that even the Las Vegas shooter now is alleged to have had, while he was doing the shooting, was on a psych med, and none of this information gets out.
And it's unclear, and we don't know how much they're going to hide it. But it looked like a benzodiazepine. But if it was Valium, they said, well, he was on Valium the day before. Well, Valium has a very long half-life. If he was taking Valium the day before, he would be on it for several days because it has a very, very long half-life.
Dr. Charles Gant, thank you for your good work and coming on today and letting us know that before we rush to judgment, we should have more context and a deeper understanding.
People need to look at the hard facts, So thank you very much for having me on.
All the best. I'm Gary Null. We're out of time. I want to thank you all for listening. I look forward to sharing more on our next program. Have a nice day.